Hi guys, this is Dr. Wagnon with Better Life Chiropractic, and today I want to show you a tool that we carry that we have our patients use to help get your curve back into your neck. So everybody should have a neck curve, and if you don't have a neck curve, or it's straight or it's even reversed, then it can put a lot of strain on the spinal cord. It can also add extra strain to the vertebra down here, which can make them wear down faster. And of course, if you're getting adjusted, it can undo the chiropractor's work. So getting that curve back has many benefits. And just as a brief explanation, when you buy a Denneroll tool like this, from us the packaging looks like this, but it comes with this instruction booklet. So it does have an example of perfect. So right here is a picture of a neck curve that is ideal, a nice C-shaped neck curve. Now some people we see have neck curves like this, some like this, and nowadays more and more people are coming in with reversed neck curves. So we want to fix this, and getting adjusted by itself can help, but at home this simple tool can help stretch the soft tissue in front of the spine to help actually get that curve back, and along with some posture exercises it can help hold that curve in position. So Kelly here is holding the Denneroll, and if I get closer you can see that it says shoulders this side. So Kelly's going to place this Denneroll on the table in that position where shoulders this side is facing the foot of the table. Now at home you're going to be using this on the floor, but nothing soft like a couch. This table is a little bit too soft, but it's good for demonstration. So now Kelly's going to go ahead and lay back on the device, and she's going to have the Denneroll tucked down low to where her head and the weight of her head can get over that curve of the Denneroll. And ideally she would lay in this position for up to 15 to 20 minutes every day, but most patients need to lay on this for a minute or two to start with, and if they get sore then they end it for that day and they try to add a minute each day until they can get to that 15 to 20 minute mark. And then they do this continually until we stretch that soft tissue in front of the spine back into a C-shaped curve, and we'll know that if we take a follow-up x-ray usually about 9 months to a year after people start using this Denneroll. And of course that all depends on the patient's cervical curve and specific condition. Now, as you notice, Kelly is laying on the table with her legs straight, so that is the ideal position. And let's pretend that Kelly had trouble lifting her head directly off the Denneroll because her muscles were nice and relaxed. An alternative way to get off of this tool is to roll to one side and then come up. So it's a little bit easier in many cases to do it that way. Okay guys, thanks for watching. I hope this video has been helpful, and of course if you have any questions or concerns, feel free to reach out to us. You can find us on the web at betterlifechiro.net, or you can call us at 208-884-5000. Also, if you like this video, please hit the like button and feel free to share it with your friends.